With February being Heart Month, it's important to take care of yours, especially after some kind of intervention. Joining us via Zoom this morning is Andrew Meverden, the Regional Team Lead of Exercise Physiology for the Upper Peninsula region of Aspirus Health, to talk to us about cardiac rehab. So first off, Andrew, what is cardiac rehab?
So cardiac rehab is an educational exercise program where we bring people in, kind of look at an overall health history of what's going on, and kind of look at the goals they have long term, and then any different medical aspect that they've had going on diagnosis wise, and give them a set plan specific to them to build up strength and endurance, monitor them to look at heart rates, blood pressures, the electrical system of the heart, and just kind of give an overall peace of mind to make sure they're on the right track and kind of build them up to get back to doing the things that they enjoy.
Who can utilize cardiac rehab?
For the most part, diagnosis-wise, it's going to come from a referral. It's outpatient setting for what we do here. And you're going to have different heart attack, stents, bypass, valve repair, replacements. If they have chronic heart failure, you will see like heart transplant for some of the stuff. Are kind of some of your big ones, but we also do see different things from the pulmonary side as COPD, chronic asthma, pulmonary hypertension, and then we do have a newer program where we do some PAD, so peripheral artery disease therapy, which kind of ties into the heart system as well.
Why is it important to go through cardiac rehab after intervention?
Basically, anytime somebody has an intervention with structural work done, or their heart goes through some trauma from, say, a heart attack, or chronically having, heart damage, you basically want to try to build back everything artery-wise in the tissues within the heart. Because when you have a surgical intervention, the basically blood pressure flows of everything change, and you want to basically make sure that everything looks good again from the inside and outside of seeing how they feel, our blood pressures within normal ranges, heart rate, and kind of look at that overall stress based on the electrical line of the heart to make sure that they're kind of not overdoing anything, but testing out what has been done and to kind of build back and build beyond where they were before that intervention was.
Recently, Aspirus Keweenaw Hospital's cardiac rehabilitation program has been certified by industry leader. Could you tell us a little bit about that?
It's American Association of Cardiovascular and Pulmonary Rehab. So it's kind of the gold standard that they have for anything certification that can be given out. And it's the only peer-reviewed accreditation process that is designed to review programs' adherence and standards and guidance developed by basically the review board and the program committee. And when they do it, it's a 3-year aspect. So we currently have our Keweenaw location certified, and then our Ironwood is certified. We're working at Iron River to kind of have all of us in the UP be that certified aspect. And they basically come out with anything for new peer review articles and everything to kind of keep us basically as fresh in the market as we can for new studies, new things, new based on recommendations. So we can kind of be kept in the loop of everything without trying to search that on our own, is a good way to kind of funnel sources throughout the U.S.
Anything else you'd like to add for people to remember about taking care of their heart health?
So with that, one thing that I would recommend is, as you're looking at doing annual visits, or if you're not doing any visits with it winter, if you're shoveling snow, anything like that, if things feel off, if you have increased shortness of breath, maybe it's chest pain, pressure, or you just feel like your exertion isn't quite there like it used to be, it's a great time to take things in small chunks and mention what you are feeling to your providers, so that way you can kind of be checked out and see if there is anything heart-wise going on, and make sure to create that awareness to be checked out and look at it and catch an issue before it becomes a bigger problem.
Thank you, Andrew. Stay with us and we'll be right back after the break.